This lecture is a simple study to see the effectiveness in treatment of jaundice in babies by phototherapy. Jaundice is very common in newborns, and the best treatment for it is phototherapy. Usually phototherapy consists of a system of blue lights placed at a specific distance from the patients. But some doctors wondered, would it be more effective if we covered the surrounding with reflectors? That led to this research. As phototherapy with reflectors versus conventional phototherapy for neonatal jaundice. It is the evaluation of phototherapy with reflectors, a randomized controlled trial. This study was done by 4 doctors: Mohammed El Sait Hashim, Reem Nabil Sait, Anas Abdullah Ali Abdullah, Hiba F. Abdel Ghaffar. The study was done in the NICU of El Nasser General Hospital, Port Said, Egypt, between June 2010 to June 2011. And the research was published on the 13th of October, 2015 in International Journal of Pediatrics and Adolescent Medicine Journal. Why did they do this study? Neonatal jaundice is one of the most prevalent clinical conditions, requiring evaluation and management within the first few days of life. Phototherapy is the single most common intervention used for the treatment of neonatal jaundice. The aim of their study was to evaluate the efficacy and tolerability of phototherapy with reflectors, compared to conventional phototherapy, in controlling neonatal hyperbilirubinemia. The question arises, why we chose this study. Neonatal jaundice, indirect hyperbilirubinemia, is very common worldwide. Phototherapy is the single most common intervention used for the treatment of neonatal jaundice. The greater the surface area exposed, the greater the effectiveness of phototherapy. Light intensity and the area of light-exposed skin can also be increased through the use of reflecting surfaces. Standalone reflectors are a low-cost, simple way to potentially increase light intensity and speed bilirubin breakdown. This is especially relevant to resource-limited neonatal units. Methodology. Design. It was a randomized controlled trial conducted over 1 year, between June 2010 to June 2011. Randomization was conducted using opaque sealed envelopes that were indistinguishable between groups, so that the investigators were unable to influence group designations. Each envelope had the assignment of the infant, Group A or B, with 30 envelopes for each group. Setting. This was done in NICU of El Nasser General Hospital, Port Said, Egypt. Sample size. The study included 60 neonates total. Among them, 30 were in reflector group, Group A, and 30 in conventional phototherapy group, Group B. Measurements. Complete blood count and total serum bilirubin were measured at admission. Then at 12 hours, 24 hours, then once daily until discharge. Patients and methods. This study was carried out in the Neonatal Intensive Care Unit, NICU, of El Nasser General Hospital, Port Said, Egypt. A randomized controlled trial was conducted after obtaining informed consent from one or both parents of the neonates in this study. The study duration was 1 year, from June 2010 to June 2011. This study was approved by the Ethics Scientific Committee at Cairo University Hospital, in accordance with the University Bylaws for Human Research. Full term, more than or equal to 37 weeks gestation, healthy newborns were eligible for enrollment, if they met the following criteria: postnatal age more than 24 hours, and less than or equal to 10 days. Had non-hemolytic indirect hyperbilirubinemia in the first week of life. They excluded preterm babies. Cases with hemolytic jaundice, including Rh hemolytic disease, evidence of hemolysis in a peripheral smear, a positive Coombs test, or a glucose 6-phosphate dehydrogenase, G6PD, deficiency. They also excluded cases requiring intensive care unit admission, including neonates with major congenital anomalies, or neonates with clinical or laboratory evidence of sepsis. This flow chart shows what we already discussed about how they chose patients for this study. Among the 99 full-term babies with jaundice, 34 cases were excluded because 25 among them failed to meet the inclusion criteria, and 9 refused to give consent. 65 candidates went for further selection. They were divided into 2 groups. A and B. Group A had 33 patients that received phototherapy without reflectors. Among them, 3 patients were further excluded from the study because they were diagnosed later with hemolytic diseases. The remaining 30 patients were analyzed. Group B had 32 patients that received phototherapy with reflectors. 2 were diagnosed with hemolytic diseases, so they were excluded, and remaining 30 were analyzed. The 2 groups were comparable with respect to gender, age, weight, and mode of delivery. The total serum bilirubin and hemoglobin concentrations at the start of phototherapy were also similar between groups. All mothers and their neonates were Rh positive. All participants were subjected to the following: a detailed history and full physical examination on admission, and on a daily basis afterwards. In addition, neonates had their temperature monitored and potential side effects recorded, including presence of loose stools and skin rashes. Clinical investigations including the following: a complete blood count, and serum bilirubin on admission, and every 12 hours thereafter, with declining readings. Bilirubin was measured once daily, until hospital discharge. In addition, a reticulocyte count and maternal and neonatal blood group tests were collected, and Coombs tests were conducted. The rate of bilirubin decline was calculated and compared in both groups. The phototherapy with reflectors unit utilized in the study consisted of 2 parallel lamps with an equal length of fixed stainless steel slices behind each lamp. The measurements of the phototherapy unit included the following: height, distance of the phototherapy from the incubator was 12 cm, length of 71 cm, a width of 25 cm, height from the ground of 160 cm, and lamp length of 59 cm. The phototherapy was placed at a distance of 45 cm from the baby. All babies were naked and wore eye pads and diapers while receiving phototherapy. The lamps were changed after every 1,000 hours of work. Results: there was no significant difference in total serum bilirubin on admission between the 2 groups. On discharge, bilirubin levels significantly decreased in Group A compared to Group B. There was a reduction in the duration of the hospital stay in Group A compared to Group B. The only observed complication in the groups was hypothermia, which was not significantly different between the 2 groups. This table shows the outcome variables of the studied neonates, with significant decreases in total serum bilirubin levels in both groups after discharge, compared to their values on admission. A significant decline in serum bilirubin was observed after 12 hours in Group A, compared to 24 hours in Group B. The duration of the hospital stay was significantly lower in Group A, compared to Group B. The graph also shows that the decline in bilirubin levels was faster in reflectors group than was in the conventional group. This study also had some strengths and some limitations. Strengths include: it is a randomized design with a control group. Practical intervention easy to implement. It can be applicable to low-resource settings. It has clinically meaningful outcomes, bilirubin decline. Limitations include: small sample, 60. The sample size was limited, making it difficult to statistically determine important outcomes. They had no access to a photoradiometer to measure the average irradiance of our devices.